Hi, John. I really glad to meet you once again and appreciate your desire to answer.
My pleasure.
So, I just really highly appreciate your speech, your presentation, which was today. And I'd like to ask you some questions, especially for Site TV channel.
Sure.
The first question, could you in general introduce yourself for our spectators?
Sure.
Yeah.
So I'm John Gerecitano. I'm one of the principal investigators at Memorial Sloan Kettering Cancer Center on the lymphoma service, and I'm the principal investigator of the co-principal investigator of the Kronos 3 trial.
That's perfect. John, do you believe that the clinical trials now is one of the best options which may be used for future prospects in development of oncology? What do you think about it?
So it's, I guess there are a couple of different answers to that question. It's certainly from a patient standpoint.
Yes.
In a disease like an indolent lymphoma, where patients will need continued treatments over time and will eventually develop resistance to chemotherapy, clinical trials as they're currently structured are one of the best options for those patients so that we can reserve chemotherapy for later times and prevent and delay the development of resistance to chemotherapy. Now, whether we can design the trials better, if that's what you're asking, there certainly are ways that we are thinking of doing that.
So, I understand that in case of need, you will recommend for the patient to participate in trials. Is it right?
Whenever there is a good window, if the patient doesn't need an immediate response, and if you're working with drugs that you're not sure may deliver that immediate response, then sometimes it's more appropriate for a patient to get something that can deliver an immediate response. But in patients who have a window of flexibility, who are reasonable physical candidates and are able to participate in a clinical trial, it is often one of the best options for them.
Thank you. Very interesting explanation. And maybe the last question. So we just discussed with you the new prospects with technical possibilities gives for the development of the communication. We just now show you the principles of immediate translation, immediate video support and so on. What do you think? Will it help for the people in future maybe to develop better communication and develop science in progress in general? What do you think about it?
I think what you showed me is revolutionary. It is always more comfortable for somebody to give these talks in their native tongue. And if they can do that, and we can have real-time translations, we can be a mini UN where everybody gets translation in real time from a speaker in their home tongue.
The Google developed these programs, the leading American companies perform this activity, and I obligatory will inform you about how it works and send you some links for that. Thank you so much, John, for this interview. It was great pleasure for me and for our spectators to meet with you here. Thank you so much.
Thank you.